be three sessions in our Caredove series. Today's session is intended to be a bit of an introduction to Caredove. We have such an array of participants on the session today, ranging from organizations with no current Caredove presence to those who have been on Caredove for quite some time but might have some new users. And so this, again, is just a really broad kind of overview of the Caredove tool and some of its basic functionality, and we will explore additional functionality in future sessions. As we mentioned, there is an opportunity to provide feedback in the form of a survey following this session. And so if there is anything in particular related to Caredove that you would like to learn more about in the future, we encourage you to either reach out to the shared services team or provide that feedback within the survey. Without further ado, I'll hand it off to the experts over at Caredove. Jeff, welcome.
Thanks, Chantal. Thank you, Reem. Can you hear me okay? Awesome, great. I have with me Tessa Smith-Moore, who is introduced. Tessa is also going to be on the message thread there. So if you have questions, you can ask there, and she'll try to intervene as well. But there will be time for questions as well. I'll leave it up to the moderator to decide to interrupt me if you'd like to. So Chantal, just break in if you think there's a discussion that needs to be had. Otherwise, I'll just be going on a track here, okay? All right, so awesome to be with this group. We have a wide range, so that's good. And it is meant to be an introductory session. So maybe here's just a little bit of background on the network and the moment in time, Chantal, that you'd like to say what's happening. Oh, you're muted. Oopsie.
It happens at least once a meeting.
Oh, yeah. Me too.
We're in a bit of a period of transition with shared resources. So we've had a Caredove network within the Champlain region for a number of years. That network is now extended to the southeast and central east regions of Ontario East. And along with that comes with a bit of a rebrand. And so our network remains the same. If you had a listing before, you still have listings today. But the rebrand is to move away from the Champlain branding towards something known as Access CSS. And so that means a new public-facing website, as well as a new public search function and clinician search function. So some of you may notice that when you log into your Caredove accounts, it may look a little bit differently. So this is a quick view.
I'll stay on the page. Yeah.
This is a quick view of the new website. Again, it's really intended to be public facing. Now, whether that be members of the public or simply external service or healthcare providers, it is intended to provide navigation and access to community support services. So again, if you had listings on our previous network, your listings have been copied under the rebranded network. For those of you in the extended region who may not yet have Caredove or not yet have listings on the CSS network, you're encouraged to reach out for more information to either myself or directly to Caredove. Thanks, Jeff.
Awesome. Thanks, Chantal. So that's a little bit of background there. Like she said, the important thing is your listings show up. One important thing is your Caredove listings show up in a variety of places. You don't have to do anything to update them or to make them appear in more places. That's on the regional side and the Caredove side. So that's great, easy for you. But we do need to go over, like, what is Caredove? How do you update your listings and manage your information there? So this is just our background slide, we're an Ontario-based company. We've been working at this. We started with CSS, but we've expanded into other domains like mental health and addictions and children's services, but all community healthcare. So it's community services like the CSS sector that we really love working with. We serve about 1,000 organizations right now across Canada, a whole bunch of regional initiatives like Access CSS. And I remember when we started, not, I guess it's about 10 years ago when we started with some referrals, and some of that was early in the Champlain region when there was just a few a day kind of thing. And now we're up to 500,000 a year across the country. So Champlain is part of that story. Champlain and the east of Ontario is part of the story of how do we make access to care easy? And that's really what we're all about, is how do we make it easy? And we love the use case of the CSS sector because it's not straightforward how to make access easy. You need all these things like integrations to other systems, right? And we need to make sure we treat the information securely, but it also has to be really easy to use. So we're going to jump through the process of, well, the Caredove platform a little bit. We'll start with just how does a referral get sent? All right, so might start on a website like the Access CSS website where we do a search. The address is really important with CSS because what's relevant in the service results is highly dependent on the address, right? So that seems very obvious to all of us in the room, but it's a very important part of the CSS process. Like, where do you provide your service? What is the catchment area, for example, of your Meals on Wheels service? It's extremely relevant to whether it's a service that can help somebody, right? So
I think that's an excellent point, Jeff. I just want to emphasize that that's what makes it so difficult for those other segments of the healthcare sector to figure out where to send someone. Because not only is it about who offers what services, but what areas do they serve and what are their eligibility requirements. And Caredove certainly helps take some of that guesswork out of that.
yeah, it's probably the most complicated eligibility sector you can think of, right? It has a coverage area, but it also has these other factors, like maybe it has a cost, or maybe it has an age factor, or so on and so forth. So just to get through the service request process, so we all know just what the base case is for helping people, it can launch a page like this from the public, but you can also launch this page from other sending systems. So this service description becomes really important because it's found in all these places, right? One service listing, find it in all these places. We'll come back to that. There's a call to action, right? Request service. This page, if there's available intake times, it'll display this page, right? Here's the available intake times. That's great. Request the service. If there aren't available intake times, we jump essentially through that process to the form so that, okay, it's a service request form, fill in the information. Again, this is quite custom to the service, right? So CSS, you often need an alternate contact, so that's going to have to be on the form, etc. So fill out the form, and the result is the referral lands, in this case, the self-referral lands in the right organizations. So we have this fictional organization called Dove Community Care that I'll be going back to. But this is an organization's inbox, and I'll come back to that. All right, so many referral channels, right? Lots of referral channels that you can receive your referrals through from other
Hello, is
CS.
John there? Hi, John. My name is Alex, and I'm a care planner.
Oops,
Hi,
I'm calling you
Alex.
because I received a referral for.
that's okay. That's part of the process, right? Everybody here on this call has multiple jobs to do, right? And it's like, how do I do this Caredove stuff while also doing these other things? So not like we planned that interruption, but we know it's part of your day, right? So we'll come back to that. Many referrals, one inbox. So that's ideally what we're trying to help you solve. You can also, integrate Caredove to your website, for example. You can also, you can receive referrals from Chris and so on and so forth, Ocean, other things, lots of referral channels, one inbox. All right. Um, I'm going to go through kind of like the 4 areas that are important that we think about when we think about how do you make your service trusted? Why do you want to make it trusted? Well, if it's trusted, then people will have confidence to refer to you, right? If they're not sure, if they don't know if the information is accurate, if they're not sure if you're going to answer the referral, if you don't, if it's unclear what's going to happen, your referability, you could say, sort of drops, right? And that's for any service. We all know what it's like to be wondering what's happened with a referral that maybe we've been referred for. All right, so updated listings are important. Making your service referable means secure, handling them all in one spot. I'm going to go through that a little bit. How do you close a loop on a referral, right? So that there's no mystery. That's being communicative, right? It's no mystery means closing the loop on a referral. And then, the icing on the cake is if you can make it bookable, right? Bookable means essentially Caradove's your intake team's personal assistant. It's like, that's when I'm available. Call me then, right? Book me then. So that's the kind of the top level that we see if you can pull that off. So I'm going to go through each of those 4 areas, and I'm going to jump into Caredove a little bit to show you what that looks like. I feel a little bit weird because I can't see the responses of people or their facial expressions, which is fine. But I do need Chantal or anybody to cut in and tell me, there's questions coming that I need to pause. So just to remind you to feel free to do that. All right. So what does it mean to keep your listings accurate, up to date, and so on? So here I'm going to jump into Caredove a little bit and talk about how listings are owned by you. Okay, so in your organization, in this upper menu up here, it says Dove Community Services. At your organization, you'll have your organization's name. So if it's, Care for, or if it's, whatever the case might be, the organization name is up here, and your upper menu will be displayed related to your organization up here. So I'm currently on the listings menu, and the listings menu displays what are the services my organization does, right? So at our organization, this fictional organization, these are the things that are managed by Caredove, by me, essentially, or the people who work at this Dove Community Support Services, right? So each of you will have your own set of service listings. This, when I open this, it tells me when the last time the listing was updated, right? I can see who last updated it. And those would be people typically at your own organization. Also, network admins, a person like Chantal, actually the person who is Chantal, can also help you with this, right? Updating listings. And when you do update listings, it's just an important point when you're working together as a group, as a network, that you work towards, for example, with titles, you may want to change the title collaboratively of your service because you do have edit permissions on the title, but you can call it, for example, day program and have a certain structured title for that. That's more in keeping with a certain regional approach that you want to have. The bottom line is you have control over this information as the organization who provides the service. You can also put a status on your service, and that's a helpful little kind of flag that shows up to the people looking for service. If you just want to have a little bit of additional information there, again, you can decide at a regional level that field is structured, right? So day programs, you might have a certain structure to how you want to share status. Those are the things you do as you become a mature network and you agree on how you do these things.
I'll jump in there just 2 seconds,
Yeah.
Jeff. So I think what Jeff is referring to is what at shared resources we call our service network tables. So for those of you who participate at service network tables, it is an item of discussion that if it has not come up yet, is kind of to be flagged for future to look at, naming conventions and descriptions of services to make sure that we're kind of in keeping with the definition of service, or creating kind of some standards so that members of the public reading those service descriptions know that when they're reading a description for a day program, they don't have to necessarily read 8 different descriptions for what may seem like different services. So thank you, Jeff, for mentioning that. Back to you.
Yeah, thanks. Just keep in mind, like we do have a broad coverage of Caredove, like it does go across the country. And we try to keep the categories to be, resonant with Ontario, but adult day program in Ontario might be called a day away program somewhere else. And so I think you'll find that most of these categories resonate, but there's always a little bit of debate around whether we should call something, for example, housekeeping versus homemaking. We kind of have to pick a name, and then you guys can kind of tailor it from there. So we appreciate your indulgence as we sometimes have to name things just in a more universal way. So we have adult day programs, for example, that would be provided at a certain address, right? These are things you drive to or somebody drives to, versus Meals on Wheels, which has a coverage area, right? So an important point about this is, again, these listings can be federated. The word federated is something you'll hear more about, hopefully, because listings federated means here's your source of truth for a listing for you agency, Dove Community Support Services. That listing may also be found, and referable from Chris, the system, from Ocean, the system, from in the future 811, potentially the system, because we're doing some discussion of that. We're trying to make it so that your listing shows up in a bunch of places and you can update it here as the sort of what they call canonical record of this is the listing that we want to be updated elsewhere. Okay, so just an important point as to why a listing's important. And the other thing you can do with a listing is edit it. So there's that edit button, and it opens up a field like this, and you can see the history at the bottom of who edited your service if you're interested. And you can specify, for example, the status, like I mentioned, the wait time, but also edit your coverage area, right? So you manage that as an agency, and that will quickly display to other locations where people will find the listing. While I'm on this page, I just want you to be aware that if you are an organization administrator at your organization, you'll be able to go to the permissions tab here in the upper menu, and you'll see who has permissions to do what. All right. And so if you're an org admin, you have this blue button that says add user. Nobody else has that unless they're an org admin. An org admin gets to add people. And so each organization, like Caredove doesn't know who works at your place. Chantel might know who works at your place, but not as well as you do. You really control who works at your place and who has the permissions to receive referrals, but also to update those listings. All right. So if you want to give people permissions to do those things, you can do that right from here. If you have org admin permissions, every organization in the East network has an organization administrator. So if it's not you, it's somebody at your place, because that's always the first user we invite. All right. So just a little word on permissions. Probably in the future, we'll come back to that at some other session around how do you manage your users well, and make sure if they're on a mat leave, put them on a leave in their permissions and so on and so forth. So there's some housekeeping to do there, but that's for another day. All right, so that's listings, updating listings, making sure that you have people who can update them. And this concept of federated listings, there's also within a listing an eligibility area that you can set, I'm not going to get into that too much, but if the person has to be over 65 or 55, you can set that in the description of every one of those services. All right, 1124. I want to keep rolling. So that's listings, referable. All right. The more referable your agency is, the better quality referrals you have. So referable means you're as many referrals as you can coming into your agency are being handled in one inbox. We're providing an inbox to the agency, but the more you can just streamline your requests into one spot, I would submit, the better for you. So here's an example of a referral inbox. And we want to be able to see, well, you can see who referrals are from, right, in the from column. This is obviously a fake referral inbox. People who have referral delegate permissions can see the information in the registrant field. I can see who the referrals are from. I can see when they were received, right? So Tessa submitted one, looks like 10, about an hour ago, roughly. And who's handling the referral, right? So when a referral comes in, who's it from? What service is it for? Who's the registrant? If a referral has been booked, the person who's being booked, in this case, Robin McBird, will get the notification because that person was booked, right? So if they do intake appointments at your organization, that person it's very clear whose responsibility is. A non-booked referral, for example, here, which has been submitted, won't have an appointment time, right? It's just submitted and it's sitting there kind of waiting for someone to deal with. So that's a different process. We have workflow tools that you can use. So often you'll see with organizations that aren't booked, they have to do I'm going to call somebody back process. So we have an icon that says, look, I've tried them twice and so on. Obviously, when you've been booked, you don't need to do that kind of stuff, but there's workflow statuses so that you can triage, handle your referrals all in one spot. All right, this is showing that a registrant sign up means it came from your website or a website. Okay. You'll see via in cases where, for example, via it came from Ocean or via Chris, via an API, that'll be evident to you. It's worthwhile just to pause there and say, for registrant signups, you can embed buttons onto your website. All right, or typically every agency has a service navigation kind of thing. This is the fake agency, Acme Community Services, obviously, but for demonstration purposes, this is quite similar to how a lot of organizations in healthcare and community health describe their services. There's a service navigation menu. What do we do? Maybe we do personal support, etc. And you can put buttons on your site, for example, that enable booking. So if that's your first step, or if you want to have let's see, I'll try transportation, request service, you could have an eligibility field there that says, do you, is the service within that coverage area that we described earlier? So it's using that same coverage area from the Caredove listing to say, well, if the person lives in Windsor, it's going to give them a fail, right, on this flow. So it can help streamline your referrals to get them all in one spot. Again, this referral inbox is the catch basin, hopefully, for those things as you become more referable.
But if I can jump in there, Jeff, I'll be really quick. From an agency perspective, I can kind of speak from experience that, sometimes on our websites, we'll link to our info address, right? Like contact us at info, where you'll get these emails landing in an info box that are missing kind of the key pieces of information you need in order to conduct a follow-up. And it's not necessarily clear what services they're looking for or who you're contacting, for example. And so this kind of replaces using that default info box for everything on your website so that they're coming in with the information that you need to offer a prepared follow-up, like those general info inquiries. How do you even know who's supposed to call them back? Because it's just really not clear, what they're inquiring about at times. So that's my plug. Go ahead.
Yeah, thank you. It's often when agencies are thinking about updating their website that they start thinking about how do they, embed good calls to action on their website. So when you get to that point, if you're interested, let us know, and we can show you some examples of different websites where there's different calls to action on them. All right, so thank you, appreciate that, Chantel. So I want to go back to now the next part, which is being communicative. So you've got the referral in your inbox. I would put organizations into kind of two buckets in my little brain, having seen a couple million referrals now. There's ones that close a loop and there's no mystery about what happened, right? Because they updated the status or they sent a message or something. And then there's other, I wouldn't say organizations, probably more just services and intake approaches where they close a loop and the person sending the referral knows what's going to happen, right? So those are the two buckets. And there's a bunch of ways of doing that well. So I'll show you a couple. I'm going to go back to the referral inbox. So in this referral here, you can see that the referrer actually sent a message. So it came in, the status of the referral right now is booked. So already the referrer knows who's helping the client and when, because it was booked. So that's good already, because they saw that when they referred. So there's no mystery in that process. This one here, for example, is submitted. It's non-booked. What I can do here is add a message to it, right? So I could say something to the person who sent the referral that, well, I made a funny message here yesterday. It says, next time, please book me. But you can message the person and say whatever it is you want about receiving the referral. If you'd like to, that's fine. I just want to make the point about messages. Messages occur within a referral, right? Just think about that. The other thing that's really important to do is, because not every referral needs a message, but every referral needs an outcome, right? Every referral is like, well, what did you do with it, right? And if you update the status of the referral right here, you can convey the message back to the referrer, right? So you close the referral and you say admitted. And if you want to add a note or a message at that point, you can as well. But at least this will send a clear message back to the referrer that you admitted them. And that's, well, as we all know, just humans, you like to get that affirmation that what you did was worthwhile. And that is a great way to encourage more of those good behaviors, right? So it shows the person was closed, admitted here, and awesome, right? Closed,
Goes a long way to building that trustworthiness, right? If we're receiving referrals that are going unanswered, we're really not building that trustworthiness within our sector as being responsive partners in the healthcare system, or from the public's perspective, that they could just kind of reach to dead end and they didn't hear anything back. So excellent point, Jeff. The importance of updating those statuses is really important. And we do pull network-wide stats on that as well, so that we can reflect as a sector how responsive we are. And so every year, I think our providers are a little bit shocked to see, how many referrals even went unread, meaning that they landed in an agency's, inbox and were actually not opened. And so that again speaks to the trustworthiness of our sector. So stay tuned for some of those stats in upcoming newsletters as well. If you're not currently registered to receive the shared services newsletter, we do feature a monthly snapshot of Caredove statistics. That's my plug. Thanks, Jeff.
We should go over that as well, just a sidebar, just on the unread point, because there is a feature where you can mark something unread even after it was read. So want to make sure that the reporting is accurate on that part. So anyways, but you get the point. The main thing is we want to convey to the sender that, thanks for the referral, and we admitted them. And probably even more importantly is if you didn't admit them, right? You say ineligible and perhaps provide a message, because now they're like, oh, okay, so they actually have to be whatever it is, right? And if you get a lot of ineligible referrals, that speaks to us updating the eligibility criteria on the service listing in step 1. Right. So if it's like, well, I'm getting these referrals in, well, let's make it so they have to click through an eligibility so as to not get, referrals that are frustratingly inaccurate, let's say. You covered off the last point right there around share data. So understand regional performance and wait times and so on and so forth. Ministry folks, Ontario Health folks, they love their data, and well, you won't have to worry about reporting if you just answer the referral, right? So, and then the last thing, not to beat a dead horse, because I know agencies are either in one of two camps. They love intake calls, or they mention things like, we have lots of things to do, like the person who was took the call during the meeting. We have lots of things to do. We have to check our voicemail. We have to, go to our inbox. We have to check the facts. We have to, so on. If you're doing a lot of that, then it's a great opportunity to get booked intake times, right? So if you're doing a lot of that, getting interrupted and so on, that's the reason, if you can, to create intake times. So I'm going to jump into the calendar, and I'm just going to pretend there's no intake times to begin with. What would I do to create an intake time? My organization called Dove Community Support, we provide Meals on Wheels, let's say, and it's like, well, I'm getting all these non-booked referrals and I don't know who's handling them, and Chantal is asking me to set the outcomes and so on and so forth. What do I do? Well, you can create an intake pattern like this little green button here. Let's say I want to do intakes on Monday, Wednesday, and Friday at 9:45 a.m. 9:45, I'm going to do 15-minute intake appointments, and I'm going to do them on Monday, Wednesday, and Friday. And well, let's say it's Robin who's doing them. And then I do them by calling people, and I do it for Meals on Wheels, and that's what I do intake for, right? I can set a pattern that ends, let's say before Christmas, but I'm just going to set it and forget it, essentially. And then when I do get booked, I know when I have to call people back. Then the only issue becomes, how do I manage the available times so as for people not to book me? And that's when you can go into the calendar, you can see the available times, they're sitting there, and you can either delete them or just mark yourself away, right? That's, you can't book me at these times, right? So if you do that, there's no mystery on the referral inbox. You're booked. These are mysterious referrals. Like, who's going to call them? I don't know, right? But if you can make them booked, then you know exactly who's dealing with them, and awesome, right? So I would say 70 to 80% of the referrals that go through Caredove are booked, right? Broadly. And the organizations that do it because they want to do it, right? So
So the alternative to booked is just a general referral for a service landing in your inbox, so that you know who sent the referral, who needs the service, what service they're asking for. But then within your organization, you have to assign that to one of your staff person, and then that game of whether it be telephone tag or email back and forth to connect with that person begins. So. Right. Not ideal, but depending on your internal workflows, one option may be a better fit than the other.
Exactly. And if in the case of non-booked, where they come in like this, where there's nobody attached and it's here, yeah, you have to create your own internal workflow for that, right? And that involves often having these kinds of flags if I've tried to call them and so on and so forth. versus, well, we know what's happening. So here we just, you can have your own processes. You don't, the system takes care of it for you. So if you have available times, the option of being booked will show up. If you don't have available times, it'll come in like this. So that's essentially how it can be configured, right? So if
Can
you
you
have
show
available
us
times, great.
quickly, Jeff, just assigning a worker to an unbooked referral?
Yeah, so there's in this three-dot menu, which is also where you can update the status. You can select this that says assign provider,
Okay, thank you.
right? Whereas over here, I don't need to do that because it's done. So it's essentially assigning it before the referral comes in is kind of a way to think about it, right? You need to do it. Would I rather do it after the referral comes in and sort of scramble, or just do it at the beginning? One is a lean process where you share and you pull into available times, right? That's if everyone's done lean and Six Sigma and so on and so forth, that is the lean process. We built Caredove from a consulting company that leaned out processes. That was essentially how we started Caredove. So that's kind of the flow. Why do we exist? To help you promote your service, build your listing, promote your service, help clients get access to all those great things that you guys do. Because they're important and they're going to be growing in importance, right? We all know the future is investing in things that keep people healthy at home and out of long-term care and hospitals and so on. So we want to help you do that. And we're here for you all the time. Well, not all the time. We're here during the daytime, right? Which is when you work. Anyways, but Tessa's not here at midnight. We're typically 8 a.m., 8:30-ish to 5 p.m.-ish. And you can find us at our support by going to the bottom right of your screen in Caredove. Over here, this little happy face. You click on that little happy face, you ask a question, and we usually answer within a few minutes. I think our standard is less than 5 minutes.
I want to jump in there and just add, so you can certainly message and chat, but I find the help button with the question mark. There are so many step-by-step resources and like little short videos on how to do things that are incredibly helpful through that little smiley face button. Again, you can always reach out to us at Shared Resources for assistance as well. In addition to connecting with Caredove through the help button.
Yeah, thanks for pointing that out. I didn't notice that. The little help there at the bottom right, that's a fancy way of getting to all the tutorials. That's great. So yeah, I guess we updated that interface a little bit. So good. Awesome. We're at the Reem, I think we're at the 11:45-ish mark. So do you want to leave